Did you know that our bodies are like a big cooking show and the bone marrow is the main chef making everything taste amazing? Hello and welcome back. In this video, we'll explore the bone marrow, understand what it is, how it works, like making different kinds of blood cells and helping us stay healthy. The chef behind the scenes making sure everything is just right for our survival. So grab a snack and join us as we discover the complex secrets of bone marrow and how it gives birth. Yes, gives birth to cells. Let's get started. Now, inside your bones, there's something super special called bone marrow. To understand it better, we need to talk a little bit about cells. A cell is the basic unit of life. There are three main types of blood cells: the red ones that carry oxygen, the white ones that fight germs, and platelets that stop bleeding when we get a cut or hurt. The process that makes these cells is called hematopoiesis, and it starts with special cells called hematopoietic stem cells. These stem cells are like magic because they can turn into different types of blood cells. They live in the bone marrow and go through a process where they grow and change under the influence of some special growth factors and cytokines. Once these cells are all grown up, they travel through our blood, doing important jobs like carrying oxygen, fighting off sickness, and helping our blood to clot when we get a little scrape. Among these cells in our body's team are the red blood cells, as we have seen. These are very crucial players. They're made in the bone marrow and look like tiny discs filled with hemoglobin. These special cells have one main job: carrying oxygen from our lungs to every part of our body. It's like they're tiny delivery trucks for oxygen. The bone marrow, in this case, ensures that we have enough red blood cells to keep everything running smoothly. If at some point you or I don't have enough of these cells, our body might get tired, our organs might not work well, and it could even lead to serious problems. So, thanks to our bone marrow, we've got enough red blood cells, not more, not less, that make sure oxygen gets all around the other organs. This service ensures that our body stays healthy and active. Apart from its role in delivering oxygen, the bone marrow takes on another crucial responsibility by creating white blood cells, the superheroes of our immune system. Think of them as our body's defenders, always ready to fight off infections and keep us healthy. These white blood cells, or leukocytes, have different types, each with a specific job in recognizing and battling invaders. Neutrophils act like first responders, rushing to the scene of an infection to gobble up harmful bacteria. Monocytes are the cleanup crew, clearing away the debris left after the battle. Lymphocytes are the strategic masterminds, coordinating the overall defense and remembering past invaders to mount a quicker response in the future. Together, these white blood cells form a powerful network, patrolling our body to identify and neutralize pathogens like bacteria, viruses, and fungi. Thanks to the bone marrow's ongoing production of these important cells, our immune system remains vigilant, ready to deal with any infections at all times that come our way. The bone marrow's continuous production of these white blood cells is crucial for our survival in a world filled with potential threats. It plays a fundamental role in creating a robust immune system that adapts to new challenges, ensuring the safeguarding of our health. This adaptability allows the immune system to respond effectively to various threats and changes in the environment. Beyond the functions of oxygen transport and immune defense, the bone marrow contributes significantly to hemostasis, the intricate process of preventing and controlling bleeding to maintain the proper flow of blood within blood vessels. Platelets, minute cell fragments originating in the bone marrow, play a crucial role in the formation of blood clots. When a blood vessel sustains an injury, platelets quickly arrive to the site, initiating a cascade of events. Upon arrival, platelets release chemical signals that attract additional platelets to the injured area, and through collaborative efforts, they create a plug, effectively halting the bleeding and averting life-threatening hemorrhage. This mechanism exemplifies the bone marrow carefully controls how platelets work together in such conditions. The bone marrow's role in this platelet communication highlights the significance of hemostasis, emphasizing the delicate equilibrium required to balance clot formation and prevention. This balance is integral to our survival when faced with injuries. Without this mechanism, even minor wounds could result in uncontrolled bleeding. On the contrary, if clotting were too aggressive, it might lead to unwanted blockages in blood vessels. In essence, the bone marrow regulates hemostasis, ensuring that our blood responds appropriately to injuries. This process is not merely a physiological response, but a finely tuned survival strategy to face of potential threats. The importance of bone marrow reaches far beyond its regular tasks in the body. In recent times, doctors have found a way to use the regenerative power of bone marrow for medical treatments. This groundbreaking method is known as stem cell therapy. Here's how it works. Special cells called hematopoietic stem cells are taken from the bone marrow and then transplanted to help treat various diseases. This innovative approach shows great potential in treating serious conditions like leukemia, lymphoma, and specific genetic disorders. What makes bone marrow particularly valuable is its ability to regenerate and produce different types of blood cells. This makes it a precious resource for helping people cope with severe illnesses, providing a newfound sense of hope for those who were previously facing challenges that seemed insurmountable. Imagine someone with leukemia, a type of blood cancer. Stem cell therapy involving bone marrow could offer a chance for their body to regenerate healthy blood cells, potentially curing them completely. This not only opens up new avenues for treatment, but also signifies a significant leap forward in medical science, offering a glimmer of hope for those dealing with diseases that were once incredibly challenging to manage. Bone marrow, while essential for life, faces disruptions in various disease states. Aplastic anemia, myelodysplastic syndromes, and leukemia are conditions that can disturb the regular functioning of bone marrow. This disruption results in deficiencies in the production of blood cells, compromising the body's mechanisms that we just talked about. To address these challenges, understanding the intricate relationship between bone marrow and disease states is crucial. Consider the case of aplastic anemia, a condition where the bone marrow doesn't produce enough blood cells. This can lead to fatigue, increased susceptibility to infections, and difficulties in stopping bleeding. Myelodysplastic syndromes involve abnormal cell development in the bone marrow, affecting the regular production of blood cells. Leukemia, a type of blood cancer, results in the overproduction of abnormal white blood cells, further disrupting the bone marrow's normal functions. In-depth research into bone marrow disorders provides insights into the specific mechanisms that go awry in these conditions. Scientists aim to identify key factors contributing to the disruption of normal bone marrow function, allowing for the development of targeted therapies. These therapies, in turn, hold the potential to restore the bone marrow's proper functioning and alleviate the challenges posed by these disorders. The ongoing efforts in this area of research complement a commitment to advancing medical knowledge and improving the lives of individuals affected by bone marrow-related diseases. By digging deeper into the intricacies of these disorders, researchers strive to uncover solutions that directly address the root causes, offering hope for more effective treatments and a better quality of life for those impacted by bone marrow disruptions. In conclusion, the bone marrow emerges as a central player in the symphony of life, orchestrating the production of blood cells essential for oxygen transport, immune defense, and hemostasis. Its regenerative capacity and pivotal role in stem cell therapy highlight its transformative potential in the realm of medical science. We therefore need to take good care of our bones and have more appreciation to the bone marrow for its ability to sustain life and its ongoing contributions to the dynamic equilibrium that defines our existence. What do you think? Tell us down in the comments section. Be sure to subscribe and activate the notifications bell. Thank you for watching.